Henry Ford Health System is looking for up to 5,000 volunteers for a COVID-19 vaccine study. The hospital system is working with the National Institutes of Health and Moderna to test their vaccine candidate in Southeast Michigan. As we told you last night, 30,000 volunteers in the U.S. will be part of a blind trial for the vaccine, where some get the vaccine candidate while others get the placebo. Those who want to volunteer or learn more about the trial can visit our website, fox47news.com. It's not only coronavirus cases that are climbing in the U.S., so are drug overdoses. According to the CDC, drug deaths rose last year after falling in 2018 for the first time in more than 20 years. And as Sarah Daloff tells us, the increases seen this year could be tied to the pandemic.
Dual epidemics devastating parts of the country. In Wisconsin, overdose deaths have more than doubled during the pandemic. One Kentucky county struggling with a surge tied to a new synthetic drug mix. And in Jacksonville, Florida, overdose calls are up 40%. One foundation offering virtual training on how to use emergency medication.
It's great to be prepared.
The Overdose Detection Mapping Application Program tracks fatal and non-fatal overdoses. Since mid-March, more than 60% of participating counties have reported increases.
Once we saw that, that's when we said, okay, what happened around this time frame that was different other than COVID. And so that's when we said, okay, state mandated stay-at-home orders.
With those orders, say health experts, came triggers for relapse, isolation, job losses, and support network reductions. But the pandemic also altered supply chains, leading some to seek new suppliers or substances. A recent American Medical Association report reveals opioid prescriptions are actually down while drug deaths are up.
Most of the overdoses now are related to illicitly manufactured fentanyl and cocaine and methamphetamine.
The AMA is urging government officials to relax barriers to treatment.
We are asking every state to look inward, look at any policies and procedures that may be negatively impacting the ability of folks who have a substance use disorder to get the care they need.
A call to prioritize one crisis while in the midst of another.